Hey, it's Dr. Dan Purser here. How's it going? Back from Arizona. I had to go do some work down there, and I'm wearing this awesome Disney hat because I need a haircut. Yep, about that time. We'll be getting it Tuesday. I just want you to see my wild mop of hair. My beautiful thick locks. It's a problem. It's a problem. It drives people crazy, I know. Okay, so tonight is our top 10 plus, really 19, top 19 mom menopause questions we're going to go through. First, Spectracell still on sale for $50 off. Why does my nose decide to run now? Sorry.
Soon as we get going, huh?
Of course, yeah. So is our Pro 7 for $50 off. Are you kidding me? Get that Pro 7 now. And the Spectracell, get them both. MT2R Endure and Renew are still on sale at 3 for $100. Also, if you're a couple and you want to get the Spectracell, we'll give you $150 off for 2 of them. Yeah, that's a great deal.
That is a good deal, yeah.
Are we just giving them away for free?
Almost.
Since when do I lose money? Usually a lot, actually. Mm-hmm. I know, I'm kind of a dork. I was constantly getting on to me for losing money all the time. Okay, so here we go. Are you ready to go through this list?
What, we're not doing the Kalimba or anything?
Oh, yeah.
You didn't even introduce me tonight.
Oh, Jackson's here with me. Brecken forgot. She's off having dinner with her husband. Imagine that on Mother's Day.
No, she's busy with their in-laws.
Oh, and in-laws. Okay. That makes sense. Well, her in-laws like to watch me.
Mm-hmm.
I'm like their favorite doctor ever. Okay, I don't know that. Okay.
Just keep telling yourself that. That's right.
Yeah, really, huh?
Mm-hmm.
So, Jackson, can you play the theme song, please?
Here we go.
You've been waiting. You've been practicing.
Now we're back to this one again.
Okay. That's horrible.
It's not horrible.
Could you do a trill in there or something?
Hold this thing up. You can't do a trill on a kalimba.
You do a trill on the kalimba.
I asked you if you wanted to play the opening to it.
That was awesome.
Very
That's
beautiful.
me on the kalimba. I was rocking that. I was rocking that kalimba.
Yeah, you were.
Yeah, it was amazing. It's funny because when I see patients, sometimes they get me laughing. And there goes 3 minutes of their visit, me laughing because they said something hilarious.
Crack yourself up. Huh?
Yeah, I crack myself. It's horrible when they do that. Okay. So you start asking the questions. We're just going to get through them and let everyone get back to their roast beef and mashed potatoes and pumpkin pie, whatever. What is that, a Mother's Day feast?
I have no idea. But I do want to wish all the great mothers out there. I hope they're having a wonderful Mother's Day. And it's kind of too bad we don't have any mothers or women on this Facebook Live tonight.
No,
but
seriously.
It's an appreciation on a Facebook Live.
We all appreciate, Jackson and I both appreciate moms.
Oh, we definitely do. I love my mom.
Yeah, I love your mom too. So, okay, it makes 2 of us. Okay.
Let's get into this.
Okay, go ahead. You ask the first question.
Okay, first one. Went through menopause. Why am I suddenly so tired?
Usually it's vitamin deficiency. Okay, let me do this right every time. Answer. Usually it's vitamin deficiencies. After going through menopause hell, you come out the other side, notice how bad you feel after all the hot flashes, everything else over. Like, man, why do I feel so awful? And either take a really good multivitamin like Life Extension's 2 per day, or Young Living's Master Formula for your Young Living. And if it doesn't pan out after a few months, get a Spectracell micronutrient panel. It'll tell you what is going on. These vitamin deficiencies and lack of hormones are what causes osteoporosis later, so you need to be on that now. Okay, next question. Was that good? Was that a good answer?
Excellent answer, yeah.
Okay, next question.
Why am I losing hair?
So answers 1 through 99. I'll tell you the 100th answer later in a second, but it's usually vitamin deficiencies. Wow. We're going to be on this vitamin deficiency all night, I'll tell you.
It's almost like that's what you do all day long, huh?
I know it is, but by the time you're 51 or 52 or 49 or whatever, you have some vitamin deficiencies happening. I'll tell you that. That's for sure if you haven't been checked. The 100th would be lack of thyroid or progesterone. Thyroid because you have vitamin deficiencies. Usually it's not working correctly. Okay, number 3.
Number 3, why are my muscles deteriorating, going away?
Well, lack of testosterone, which comes from your ovaries, would be the most common cause. Lack of DHEA would be another cause, which is also from your ovaries and from your adrenals, and vitamin deficiencies. Here we go again. Vitamin deficiencies.
Always. Number 4?
Number 4.
Okay, why am I so dry down there?
Ugh. 99% chance it's lack of testosterone. You must use a compounded, not available any other way, liposomal testosterone cream, usually made at 20 milligrams per gram, and you usually apply 1/4 gram once or twice a day to the area, and it does get rid of it. Estradiol cream does not work.
Are there just not effective estradiol creams?
No, they just don't work.
Not at all. Okay.
That's not for that particular problem. They do not work. It also suggests if you are young living, get on some PD80/20 like 3 or 4 times a week for a while to build up your testosterone serum levels. So.
We did just get a wonderful someday mother and here to the podcast studio. Bailey is joining us.
Still checking in.
She's setting up right now.
Are you ready to go?
1 second.
Okay, number 5.
Okay, number 5. Why does my husband have less desire for intimacy?
Well, answer first. Men do not go through menopause. That's just an old wives' tale. Well, it's old doctor tale, really. This doesn't happen. It's usually low testosterone from low vitamins, or it could be pituitary damage, and low libido, low vitamins, low testosterone can all be from vitamin deficiencies. Get him either on a vitamin or get him on Spectracell. You've heard me talk about this before. So if it's both of you who need Spectracells, like I said a minute ago, we'll do a couple's Spectracell where you each get one, and it's 150 off. It's like, wow, Bailey will not be able to finish nursing school.
Yeah, who's getting paid for it?
Yep, not going to happen, Bailey.
So
We just gave it all away.
Not to get too off track, I guess this is more of a question for me. But for men raising testosterone levels, what are those vitamins that you can take to start that process?
Master Formula or again Life Extension, 2 per day. If you're not Young Living, just get that off Amazon. And Master Formula from Young Living.
Cool.
They're just both really good choices either way.
Mm-hmm.
I think the Master Formula is a little more complete. But yeah, it's because I had a hand in making that.
Yeah.
Okay, number 6.
Number 6. Why do my joints hurt?
Probably because you're bowling too much. No, okay. Lack of hormones. You need HRT. Think about lack of testosterone, estradiol, progesterone, DHEA. Your joints are going to hurt. You're still going to start getting wearing of the pads in there, and it's just going to get bad. So the more you can fight it with HRT replacement, the longer you'll go. And there's no reason not to do HRT replacement, hormone replacement therapy. There's no reason not to. I know you've heard all these reasons, but trust me, there's a way around everything. So most of the reasons are bogus.
But you do want to go bioidentical hormone?
Bioidentical hormones, yeah. You got to be really careful with that.
Yeah.
Okay, so Bailey, number 7.
Why does my back hurt?
Answer. This could mean this could be many things, but osteoarthritis is usually the most common. You know, your spine, your discs are just kind of wearing out by the time you hit your 50s or 60s, especially if you're like me and hauled hay and did heavy labor and all that kind of stuff as a kid. But there could be other possibilities, and they're a lot more horrible usually. It could be a chronic kidney infection. It could be even a kidney stone, but you know that. It's really bad. Or it could be colon cancer or uterine cancer or ovarian cancer. These are kind of the options. They're not good options. So it's usually osteoarthritis, though.
Early screening, that's important.
Right. Nurse Bailey. Nursing student Bailey.
That's right. That's fun to remind everyone. Bailey is going through nursing school right now. She's doing a great job helping us in the office on her off time.
Now you dropped to number 2. Aren't there like 3 of you in the class?
Oh, darn it.
Okay, number 8, Bailey. You're dawdling.
I don't want a colonoscopy. What can I do?
You know what? You're a nursing student. You should get one.
Oh, I've
never
had
mind.
to deal with teaching people about it, and they hate it.
No, answer. Shame on you. You need to get the colonoscopy. But if you just can't face it, get what's called a FIT test. FITT. Cheap and easy to do in the privacy of your bathroom. It's looks for antibodies or antigens to get cancer, colon cancer. And studies have shown it to be 3% more accurate than colonoscopies. 3% more accurate than colonoscopies.
That's crazy.
Call my office, order one at 801-796-7667, or email us at info@danpursermd.com. Boom.
Boom.
9.
Why am I gaining weight?
Probably it could be from lack of hormones. That's the most common because you're not exercising as much. The lack of hormones throws you off. Plus, if you have vitamin deficiencies, trust me, you will eat to try and fix those deficiencies. Whether you know you're doing it or not, it happens, and you start pounding on calories because you're trying to feed those vitamin
I
deficiencies.
can completely agree with that.
Yeah.
100%.
You start craving like crazy.
Yes.
Number 10. Well, we're to 10 already. We have 19 total, so
We're doing good.
Mammograms. Don't want to get it. What else can I do?
shame on you. No, sorry. Answer, though not as accurate, get a thermogram or a diagnostic ultrasound. Your doctor has to order the latter. It's very accurate if you feel a lump. But if you feel a lump, especially in the upper outer quadrant, if you draw a plus sign on your nipple, it's this one up here that goes up into your armpit. That quarter, 85 to 95% of all malignancies, all breast cancers, occur there.
That's interesting.
So you need to always, when you get once a month or once a week, when you're in the shower, feel that area, especially soap it up and feel it, become really familiar with it, so you know immediately if there's a lump or bump there. So, and if you want to get a, oh, sorry, we're not on fit test anymore. Never mind. Okay.
Thermograms.
But if
and
you do
mammograms?
have, no. If you do, they know how to get thermograms. They can Google that. But if you do, do have any lump or bump or a positive thermogram or anything, for heaven's sakes, get a mammogram. Give it up. You need to run and get that thing as quick as you can. Even though you haven't ever had one before, get it, because you're about to be in a fight for your life, possibly. You need to have every tool, everything you can to be there. And I'm for doing everything, surgery, everything, and everything natural too. You're really got to do everything to get the odds in your favor when you get breast cancer.
Yep.
And so the peak age of breast cancer, when it has historically been here in the U.S.?
55.
65.
Oh, I was close.
14 years after menopause.
All right.
Which again says estradiol and progesterone do not cause breast cancer. But now we have a bimodal peak. There are two peaks.
What's-
like little...
Is that what
never mind.
bimodal means?
Bimodal? Two peaks, like two little breasts. Never mind. Okay. So, so what? I can't believe I said that. Was horrible. That wasn't humorous. So one at 25, or one at 35, and one at 65. Why are we seeing one at 35?
Probably done having babies. So your hormones. No, not even
No.
close. Okay.
What do a lot of young women take so they don't get pregnant?
Birth control.
That's why we've seen a massive increase in the last 20 years in younger women with breast cancer. So then it peaks at 35. Okay, number 11.
I can't sleep anymore. Help.
Wait, that's number 11?
Mm-hmm.
Oh, that was 12. Sorry.
We'll call it number 11.
Yeah.
Okay, answer. This is usually from lack of progesterone. Get some and use it before bed.
Mm-hmm.
Now, number 12.
I have horrible anxiety. What do I do?
You get the questions on the right number for it.
That'll cause anxiety.
It's actually from lack of progesterone or testosterone. Progesterone is very calming to women.
Yes.
Even testosterone can be.
Yes.
So, in taking some at night or even a drop or two during the day of some really popular product, anyway, it can help with anxiety.
Completely. It's
Yeah.
helped me wonders.
Yep.
Okay.
Okay, 13.
Will taking estradiol cause breast cancer?
No. The studies have shown taking the bioidentical estradiol actually reduces your risk of breast cancer by 30%. Remember, I just pointed out that the peak age for breast cancer is 65 still. It's bigger than the age at the peak at 35. And women haven't had estradiol for I don't know, 12, 13 years by then, 14 years. So, yeah, it's just not if you happen to have estrogen receptor positive breast cancer, it's just bad luck. It's just the luck of the draw. It has nothing to do with that. You were on estradiol or you had estradiol. Because the Nurses' Health Initiative showed that women who took straight estradiol and that's bioidentical estradiol, by the way, had a 30% reduction in breast cancer. Okay, next question, 14.
Will progesterone cause breast cancer?
Absolutely not. No. Answer. So I got to do the answer thing first. Answer. No. Taking bioidentical progesterone actually reduces your risk of breast cancer by
500%.
500%. Yeah. Do they teach you that Hunsky word at nursing school?
No, that's just Billy.
Okay.
So that's a pretty common misconception. You talk about it all the time, but I think it's just really important for us to reiterate the difference in the progesterones.
Right. The synthetic progestational agents in birth control pills and in Provera they have increased your breast cancer risk by 250%, and the natural progesterone reduces your breast cancer risk by 500%.
There it is.
Yeah. And you don't clot with the progesterone either. So
Which is another misconception.
So yeah. So did you catch that? That was not an error. If you take enough natural progesterone, it reduces your breast cancer risk by 500%. Somehow that got numbered number 15. Sorry, that was a misnumbering.
All right.
Okay.
We all win some, we lose some.
Yeah, apparently.
All right. Will testosterone cause breast cancer?
No, just no. There doesn't at all.
Awesome. Will
Number 17.
Will estradiol cause strokes or clots?
Yeah, it can. Rarely, but only if you have a genetic error known as factor V Leiden or factor V Leiden. V is Roman numeral for 5. Or you're outside the 10-year window and some doctor accidentally gives you estradiol orally. So if you want to learn more about oral versus topical, get my little book off Amazon on estradiol. It's super cheap. The Kindle version, or get the paperback. And next time you see me at a conference, I'll sign it for you. But yeah, it'll explain all that in there if you have curiosities about it. I've got the progesterone book and estradiol book. They're well worth getting. Probably better even is my Program 120 Handbook B, which covers all the hormone stuff. So, okay, number 18.
Why are my nails so brittle?
What do you think? Vitamin deficiencies.
I wanted to say it.
You get ridges in your nails or dips or curves or ridges.
Anything unnatural?
You can tell when I diet, I get a big dip in my nail. And I've been dieting.
Like a slope.
Yeah.
Yeah.
Yeah, I've really been cutting back. So I'm up to 120 push-ups now at night.
So proud of you. I can do 121.
So my goal is to get to 200 in the next 10 weeks. So we'll see.
We can live stream a push-up contest.
Let's do it.
You can do that.
Yeah, it'd be kind of fun.
Wait, you can't use Justice as your champion.
That's what I was gonna do.
This is Mortal Kombat. We can choose our champions.
But he has to do 3 times more because he's 1/3 my age.
That makes sense.
Makes sense.
Okay.
Did you hear that? He's not listening.
So number 19, is this the last one?
Sure
Number
is.
19, this is the hardest one.
I'm not going to do it.
Come on.
I can't do it.
I've been waiting.
Oh, I'll do it. I'm happy to do this one. Why are you such an amazing and great doctor?
Wow. I can't believe you guys asked me. Answer. You guys do listen to me on these Facebook Lives. And all my patients, I'm going to cry in friends. You made me. And you allowed me to reach this point. Plus, I think I missed the day in medical school where they put us through that machine that sucks the curiosity out of your brain. Because so many doctors have no curiosity. And I love all these facts. I love all this information. I love how everyone gets it wrong. All the doctors out there, it seems like they get it wrong. It's like, really, dude, read an article. Yeah, and they say I don't know what I'm talking about. I'm like, really, read a book. Read my book. Because I've written books about so many different topics. You know, I've had 17 number one books. So just throwing that out there. Okay, my books have been 17 number one times or more. Mm-hmm. Okay, so that's it. Because I know you guys, were there any questions?
Oh, yeah.
There's a couple.
Questions.
Okay, ask me some.
I got a good one. What should you be taking if you're past the menopause?
Well, HRT, estradiol, progesterone, testosterone, or if you're into essential oils, sclerescence from Young Living, essentially, sclerescence or clary sage, and still some kind of progesterone-based product, and something to increase your testosterone. If it's Young Living, it's PD-8020. If you're not Young Living and it's HRT, it's compounded testosterone cream.
Excellent.
Very nice.
And vitamins.
Wonderful. Can you do testing remotely, or do you need to travel to Utah?
I can do it remotely. You eventually, if I prescribe you something, you're going to have to come and see me. But we work that out, timing and everything else. But you got to see me at least once a year in the state in which I'm licensed, so I can examine you and evaluate what's going on. But otherwise, we do Zoom calls and everything else.
Yep. For all supplementing, we can do testing and putting you on the right regimen of supplements.
For supplements, yeah.
Over Zoom and
you
phone
don't have
calls.
to come and see me.
Mm-hmm.
I've got a couple good ones.
Okay.
Are the deficiencies different if you go through an emergency complete hysterectomy?
No. Different than what? Yeah, everyone has different deficiencies on their spectral cell, and hormones, it's according to how long after the hysterectomy has occurred.
That's a good
Because you can have normal hormone levels for 6 months or so.
Post-hysterectomy.
Before they drop, yeah.
Gotcha.
That's usually not that way. It's usually they start dropping right away. But I've seen them be still up there 6 months later, a year later.
Mm-hmm.
That's a weird situation. They usually left some part of an ovary somewhere.
Yeah.
One question I saw, I'm not sure exactly how to pronounce this. What does sudden creepy?
It's like crepitus.
Okay.
Yeah.
Skin. What does that indicate?
No, creping skin.
Yeah. What does that indicate? How do you fix it?
I don't even know what you can do for it. It's just nuts. You're losing your fat. You're losing your tone. If you gain 20 pounds, it'll probably go away, but I hate to tell you to do that.
Speaking of gaining, would low estrogen be the reason for menopause weight gain?
It could be, or low testosterone, it could be all the above.
It's a balance.
It could be vitamin deficiencies. I know, which doesn't make sense, but it does in the sense that you'll be craving like mad.
Yeah. Can your hormone levels drop before you are in menopause?
Yeah. I mean, they usually do anywhere from 1 to 5 or 6 years before.
I'm in my 20s and I have a drop. So
that's a vitamin deficiency.
And I'm on lots of vitamins.
You're talking about you.
Well, no, I was reading a question.
Oh.
And I just wanted to share because it's
all about me. Are you sharing
me.
Your personal stuff, or are they asking a question?
Me, my personal stuff.
Bailey, no, we can't discuss you on here.
Fine.
That's for your nursing school to all break into that deal.
Fine.
Okay. And thanks for helping out tonight.
Of course. Sorry I was a little late today. I didn't know I was doing it.
Yeah, you fit in perfectly.
I always do.
There was another question. I don't know where it went. Are the deficiencies different if you go through an emergency complete hysterectomy?
That's we just
I did that one.
Oh,
that
wow.
was like
Sorry.
the first one.
Sorry.
I have a glutathione question.
Mm-hmm.
We have somebody saying they've been using glutathione for the last some events she's doing, and she's noticing her feet don't swell and ache as bad. Is that what helping it?
I don't know.
Yeah.
Could be, but I don't know that.
If it works for you, it works for you.
Okay.
Oh, okay. Sorry, I remember the question.
Yeah.
They're struggling to have their doctor get them progesterone cream, a prescription for it. What
Progesterone
options?
cream goes dead after about 30 days. Don't bother. Ask for Prometrium or generic Prometrium, 200 milligrams. Generic Prometrium or Prometrium. You want the generic. Prometrium is ridiculous how expensive it is. But generic Prometrium and Prometrium, they're actually bioidentical progesterone in prescription form. If your doctor won't prescribe you proper progesterone, you can get that. It's safe, it's beneficial, and it works, and it's better than nothing.
As a cosmetic product, is there something else they can play around with too?
Yeah, Progestins Plus from Young Living, and Zonzarel, Progesterone
Great.
are good options.
All right, one last question. Your voice sounds so young. What hormones are you taking?
That's wow. Everything. I take everything.
Yeah.
I had pituitary damage in 2001 from a car wreck. That's how I ended up down in Southern California at the university I was at because they couldn't get help here in Utah for it. I killed my pituitary, so I essentially have to take everything.
Yeah.
Which sucks, but
It
that's the way it is.
kind of what you were saying before, a lot of that is what led you to be able to help so many people. You were
Right.
trying to help yourself
I
first.
get
and
it.
then,
Boy,
yeah,
do I. I'm worse than almost everyone.
first-hand experience, yeah.
Yep.
Okay, well, I think we'll keep on looking at the questions we can answer over the next couple days.
Okay, but let me say one other thing. The next Facebook Live in 2 weeks is going to be about osteoporosis. My top 10 tips to flip it to normal. Got it?
Got it.
Osteoporosis, top 10 tips to flip it to normal. Can it be done? That's the question. You're probably all wondering, and wow, because when you have osteoporosis, you're like, I don't want to take the bisphosphonates. I don't want to take those awful medications. You have actually really, really good options other than that. So for any of you who want to be prepared, get my osteoporosis book off Amazon. But we'll be doing the same thing, top 10, maybe 20, who knows, tips to flip your osteoporosis back to normal bone strength.
Awesome.
It'll be fun.
Woo.
Okay, in a second, my list will go up. Excuse the typos. It's really tired because we traveled all day today. There's a couple in there I know now looking at the list.
Every time.
I know. I can't ever dodge them. So God bless. Take care and go in good health, please.